Hey, welcome to Behind the Body, the podcast for those who work in the field, interested getting in the field, or simply interested in cosmetic surgery. I'm your host, Shomara, owner of Meika Services, with a passion for educating on cosmetic surgery and what goes down in the MIA. For those who don't know me or my company, I've been in business for the last 6 years in the Miami area, providing pre- and post-op education, as well as care, massages, post-op treatments, and so much more to thousands of dollars across the nation. And today, we're chatting it up about working in the Miami beauty industry, as well as working with celebs and influencers, and Hollywood's newest secret, the weight loss injections. And today, I have two special guests with me who's ready to share their knowledge, and I'm truly, truly excited. First up, we have Val with Valmart.
Body and beauty.
All right, and then we have Meika.
Yes, the Injector Maven.
And so together we're going to just be very, very transparent. We'll start with you, Val. Go ahead, tell us a little bit more, dive into what you actually provide, what your company is about, how you got started. Let's hear it.
So my name is Val. My business name is Valmart's Body and Beauty. I do body sculpting with therapy, non-invasive services. I started 2 years ago. I got the services done myself.
Okay.
Long story short, at the time, I had an incident happen in my family, and I was just like, what is it I need to get into? What is it I need to do with my life? And since I got the services, I was like, I'm in love with this. I want to learn more about it. Looked up at a school, started school, and I got certified and definitely love it now. Like,
nice.
I love doing what I do. I love making people happy, changing their confidence. So I'm definitely into it now.
Awesome. And so you actually have a physical space.
Yes, I have a suite in Miami Lakes.
Okay, in Miami Lakes. Yeah. Now, have you always had a suite, or were you providing services?
I started from my house.
Okay.
Yeah, I started providing services from my house. Then I moved on to I rented out a small room in the salon. Mm-hmm. And then now I have my own small suite in Miami Lakes. Yeah.
Nice. Congratulations. Yeah. And it's only been 2 years.
Yes.
Wow. And you do it full time, right?
Yes, full time for now. Yeah.
That's awesome. Congrats.
Yeah, I'm excited.
All right. And next up, Meika.
Hi, so I go as Meika. So my name is Meika Mirabelli, and I am a board-certified family nurse practitioner specializing in aesthetic medicine. I'm also, some people may know, but I'm a Florida barred attorney. So I've been practicing law since 2004, but then I switched it up. Like in 2010, I went back to school because I wanted to get into nursing and beauty. Mm-hmm. And since 2018, I've been practicing aesthetic medicine at some very popular and reputable med spas. Currently, I launched my baby, Maven Aesthetic Studio, and that has an adjunct institute where I'll be teaching basic Botox and filler. And the services that we have are all the neurotoxins, filler, PDO threads, weight loss, and IV therapy.
Wow, congratulations.
Thank
that
you.
is amazing. That is amazing. So quick little snippet on how I met these wonderful ladies is that, well, Val, I was actually, I met on social media, right? Informally, I had a client who booked me for massages. She did Lipo 360, and she was like, "Oh, Val from Valmart, she recommended you," and she booked like 20 sessions with me. And from there, I was like, "Okay, she seems cool. Let me keep in touch." So. Awesome. Thank you so much again for that referral. And then with Meika, this was very interesting because my homegirl was like, "Do you want some PDO threads?" And I was like, "I've done it before." And I'm like, "Never again," because it was super painful. And she's like, she's looking for a model and she needs someone to come in and do PDO threads. And I'm like, I told myself never again. and so I was like, okay, well, let me think about it. And then I don't know if I reached out to you or you reached out to me.
I think she gave me your contact. I don't remember how it was because it was like last year.
It was like a year,
so,
yeah. Maybe longer, was it? No, it was
a little
last
bit over
year.
a year. Maybe a little bit over a year, yeah.
So a little over a year, and we decided to go with fillers. And I was like, ooh, this is my chance because I always wanted like a more chiseled jaw, more snatched face. So I was like, okay, we did a consult. You went to work on my face. I even cried the next day. It was so painful, but like once that 3 weeks, I trusted you, and the 3 weeks settled in. I was like, "Oh, I'm happy."
Yes,
So yes, so that's how this report started. So very, very cool. So definitely, thank you again for both of you joining me today.
You're
So
welcome.
let's dive into the nitty gritty, right?
Yes, I'm excited.
So one thing you did not mention is that you used to work in the post-op care side of things.
Oh yeah, I didn't mention that. I've been doing a lot of things.
Yes.
I started a business, Cosmetic Care Recovery.
Yep,
And-
that's the one I knew about.
Right. And it was right. Oh, it was still COVID, I think, at the time. And I did it. I just had a young baby. And I decided I wanted to do that. And I stepped away from aesthetics for a couple of months from injecting because I didn't want to be that up close and personal. Because as you know, when you're
With
injecting
COVID,
someone's
yes.
face, you have to be like right in their face.
Yeah.
And so I took a small break and I started that and I've scaled it now. I have, CNAs and RNs.
So you
and
still
stuff.
have that, the private care?
I'm just not actively in it because
Okay.
I'm injecting every day.
Wow, that is amazing.
Thank you.
Okay. So with that said, how has it been? And I know you get a lot of post-op patients too, but further down the line, how has it been with working with post-op clients for you both?
I'll go. Well, honestly, I'll say good and bad.
Good and bad.
Yeah, because when I first started working with post-op clients, they will come in for wood therapy. The work that I've seen, someone will be good, someone will be, it's kind of scary, and they tell me how, as far as like the service with doctors and stuff, like they don't really do their research. And I do feel bad for most of my clients. Some of my clients is very hard to see that then the doctors are not being as attentive as they should be with their patients.
Right.
But as far as others, it's been good. They can't take the pain because it's very uncomfortable.
Right.
But, it's been good though.
So when it comes to like wood therapy, they can't take the pain?
Some of them is like they can still feel it, and sometimes it's like they just have to heal properly. And I always tell them, have you ever reached out to your doctor? They always say the doctors don't reach out to them.
Nope.
And so you experience that as well.
Oh
too.
yeah. Oh
And
yeah.
it's very hard, and I hate it because I feel like it shouldn't be like that.
Right.
I
think I'm more on the side because I've been in the post-op field for so long. I don't want to say I'm insensitive, but I'm more of like, I've learned to accept the fact that the girls don't hear from the clinics or the doctors after that day.
Yeah.
After they do their surgery, it's a wrap.
It's like
They're not. Yeah, they're not going to hear. It's very rare that you will hear back from where you had your surgery. So I'm kind of like, all right, well, this is the predicament we're in. We got to just keep it moving, you know? But it's interesting enough. You said it's a little scary. Why is it scary?
For them, from the conversation that I've had with my clients, they just feel like it's always about you never know how your body is going to look. You know what I'm saying? Like you can tell the doctor, I may want to look a certain way, but everybody's body is completely different.
Absolutely.
You know what I'm saying? So once you get out of the table and you're out of surgery, you have done with your massages, it's a big possibility that you may get fibrosis, or the results you may not like, and you may have to go back for a second round. So everything is not always promised.
Right. Okay. So how do you deal with clients who are not happy about their bodies?
I always tell a client, the same mindset that you had going into surgery is the same mindset that you need to have after surgery. You can't expect everything, and because you probably didn't get the results that you wanted, now it's your time to change that mindset completely around and to really focus on what is it that you want to do. What is the end goal?
Right.
Do you have to work out? Do you have to change your eating habits? Because some of them go in surgery thinking, I go in surgery and I'm going to come back out and I'm completely okay. I don't have to eat better.
Right.
But I do know one of the things that the doctors do tell them is to change their diet.
Absolutely. Yeah.
So I do try to kind of help my clients try to change their mindset a little bit, because your body is gold. You want to treat your body as such. So,
I like that. I like that.
I really am big into that. My clients are like, I know, but you have to change your mindset. Nothing is going to happen overnight. Even if you get surgery, you have to change your eating habits. You have to work out. Even if you get body sculpting, you have to change your eating habits. You have to work out. So.
Right. And you just made me think about how when I was prepping for surgery, I prepped a year in advance. And I didn't know when my surgery date was going to be, but I literally prepped my body, started eating better, working out with a trainer, and I was going hard. And I kept that up for about a year and a half after surgery, and then after that, it kind of went downhill. But
but you know what? That's the part of that's called balance, because it's okay. We're still humans. We're still gonna eat. We're still gonna have fun. But the fact that you know that you have to get yourself back together and okay, I did this. Now it's to get back. Let's get back on track.
Right.
Some people don't have that. You know what I'm saying?
Yeah.
So you just gotta have that. You gotta change that mindset. Completely.
Absolutely. Now, have you had surgery?
No.
No?
I want
So
to.
You don't even know how it feels.
I want to. Though.
Okay.
I want
okay.
To. I really do. I really
What do you want to do?
My boobs. I want to get my boobs done.
Okay.
And I wouldn't mind a little lipo.
A little lipo? Okay. Okay.
Yeah, so I'm not against it at all.
Okay.
I'm not against it at all. I'm all for it. If that's what makes you happy, and I say go for it.
Right. Yeah.
But it's just the discipline after and the research before.
Okay. I like that. The discipline after and the research before. That is
I like
you're
that.
just dropping gems right now. Okay. And so she mentioned it's scary. How about for you? Because when you're dealing with, you said you had a recovery home, dealing with private care, you're injecting faces. Like, I feel like the face too is like, ooh, like you mess up.
Yeah.
That can be pretty scary, like she was saying. So how has it been for you? Talk about, like, how do you manage your clients' expectations and, maybe some horror stories?
So managing expectations, that's a huge thing. So when I consult with a patient, I mean, I'm a talker.
Okay.
Like I start, especially like if I know it's going to be painful, I let them know, listen, this hurts. Like, one thing I
tell
hate.
me that.
What? Because actually what you got is that's supposed to be that painful. I think you just have probably like a lower threshold, and that's okay.
Really?
Pain is pain. Everybody's pain is different.
Yeah.
But typically, like with filler, it's not as painful.
Okay.
If
okay.
somebody, takes a lidocaine, and stuff.
Do you
But
remember? I was like, I'd rather do
know.
another BBL than to do this.
you were like squeezing the stress ball.
I had a stress ball, yes.
But look at the results.
Yes.
But yeah, so I manage the expectations. And of course, after each patient, I learn more and more as I go on. Practicing is a learning experience. I learn as much as I teach.
Okay.
And so one thing I always hate is like when I go to the doctor and they say, oh, this is going to be uncomfortable. And it's like, this is not uncomfortable, sir or ma'am. This is
Right.
painful.
This is
And then it's like there's a lack of trust there because then you're like, well, what's going on? Why is this painful?
Right.
And so I never wanted my patient to feel like how I felt having procedures. So I always let them know, listen, this will be uncomfortable or this will be painful. We're going
Right.
to try to make, one of my things that I want to do with my patients is have them comfortable. And then that also fosters trust.
Gotcha.
So, I do that, manage the expectations. Now, horror stories, I find like I've been lucky, I've been blessed, thank God. I haven't
knock
had
on
anyone,
wood.
knock on wood, I haven't really had anyone come back to me with like a side effect or a result that is like out of the ordinary because like this is medicine and so there are things like drugs have side effects.
Absolutely.
Like when you're dealing with Botox, you may have an eyebrow that's higher than the other. You wait for it to settle in,
my God.
but it can be corrected. It happens. You know what I'm saying? Everybody's
Yeah.
anatomy is different. To me, that's not a horror story. That's something
Okay,
that can
yeah.
happen. I haven't had most of the horror stories I have is when I have patients who may not listen to what I tell them.
Oh.
And then
we
they
all?
come back and they're calling like, why is it this? Why is it that? And I'm like, well, remember when I told you
Right.
you're going to have swelling for 2 weeks. Please don't plan on going to a wedding, going on vacation,
Right.
having a birthday celebration, like any milestone events. And they don't listen, and then they're like going to their church meeting and they're swollen and they're upset with me,
Yes.
So usually it's that when I have disgruntled patients. To me, I mean, that's probably the most uncomfortable I've been
Okay.
doing this so far, knock on wood.
Okay.
Yeah.
So do you ever get nervous like, oh, shoot, I don't want to mess up this person's face?
I love it, so I never really get nervous. And I always, I tell my patients, I actually pray over them. I pray before I go to work,
that is
and I pray
awesome.
over me and my hands, and I pray over my patient. Please, God, cover them.
I love
Let them
that.
have a good result. And so thankfully, like, you know, I haven't had that issue. And sometimes like right after, and I think that even happened with you, right after, I always say trust the process, please.
Yes.
Like you do see a difference right away, but it's like, I feel filler has a time where it cures, and even Botox. So I'm like, you're going to wake up tomorrow, Shomara, and you're going to look different. I'm telling you, just trust me.
Yeah.
And you did. You text me like, oh my God.
In the morning, I went to do my morning routine. I looked in the mirror, was like, oh shit.
Yeah.
I felt like I looked like one of those people who did too much Botox, like a clown. And I was like, oh my God. And I texted you. Right. I don't know if I called you or texted you. I remember texting Courtney, like, please tell me, because I was getting ready to go work out. I was like, please tell me I don't look this crazy as much as I thought I did, you know? And she's like, well, she's like, and I remember I wore a hat that day to go work out because I was kind of embarrassed on how I looked, but I did trust you. And I was like, all right, well, if it don't come out looking the way I want, I know she's going to fix it.
Right, because you have to factor in the swelling. I mean, your face is adjusting.
Yes,
your face is like,
so
whoa, what's going on? And then like after 2 to 3 weeks, I mean, it's like chef kiss.
Yes,
like, it's so nice.
Yes,
so,
my cheekbones.
I actually looked on your page and it looked really good.
Yeah,
and
her
I
work
see
was
that
really good.
person. It looks amazing. Your work is amazing.
Thank you.
Yeah,
Thank you. Yeah, I definitely feel like it got better over time. And then
does.
as my weight have fluctuated, I mean, obviously when you lose weight, you slim down more, but I feel like you could really see it.
Yeah.
Yeah. So
I was
thank
looking
you.
like, I want to
You're
try
welcome.
You should. Come see her.
I definitely want to try it.
Yes. You know, and I mean, ever since, and so one thing I've noticed is that, especially when I was posting about it, like people couldn't believe I did it. And so I feel like, and this is definitely getting away from topic, but I have to say this, is that a lot of people of color, they do this. But they don't talk about it. They don't share about it. It's kind of looked at like a bad thing, like only
Absolutely.
Caucasian people do it. So can you talk to us about that? Like, how do
There
you...
definitely is a stigma. I think it's gaining more popularity now. Like, because the thing is there's like, okay, black doesn't crack, right? So like a black person can never get Botox or like neurotoxin, which they always doing it. Like these black celebrities are getting it. I mean, right here, I have crow's feet, you know, like there's certain things like, it's not because you're old or anything. It's really just if you're doing that expression over a certain period of time.
Right.
And of course, age coincides with that.
Yeah.
Then you're going to have like those cracks or those imperfections.
Right.
You know, but yeah, I mean, I feel like, you know, now because I do work and I have worked at a place that they do focus on ethnic skincare. And so the majority of my clients at that particular place, they are ethnic. They're, you know, Hispanic, Caribbean, African American. And I definitely expose them to it. And I think, you know, they're comfortable with me because they see someone
of color doing it.
that looks like them. And so I've definitely, you know, introduced it into that small community.
That's awesome. Yeah, I just remember posting. People were like, responding back to the post, like, you didn't need that. And I'm like, okay, well, we don't need a lot of things, but we do it, right?
Yeah, you can
I have a
benefit from it.
question.
Yeah, there's a lot of things
Would
you
you
don't need.
suggest for someone to get it at a like younger age, or would you want them to wait till they reach a certain age to get Botox?
Well, you can't get it before 21, like certain products, certain injectable products. So, you know, it depends. Like, I can look at someone's face and say, yeah, you might need some Botox. And we call that preventative Botox. And that is gaining, like, huge popularity now.
Yes.
Because then you won't need to do, you know, I have people coming to me and they're 60, and I'm like, well, yeah, I can make you look, I can improve it, but it's not realistic what you're trying to achieve because there's only so much you can do, you know? So, yeah, if you start earlier, like maybe 21, not so much, but like if you're maybe mid-20s, you're starting to see, like maybe you squint a lot, you may have crow's feet earlier than most, you know? And then, you can.
Yeah.
Why not?
You know, it's so funny that you asked that because a lot of people, and even my sisters, they're both like, oh, I'm going to wait till I'm like 40, 45 to start doing it. And I'm like,
I wouldn't.
No, prevention is better than cure. Prevention is always better than cure.
Right.
You know, so it's like, no, start now. Especially well, I ain't gonna talk about her. But, you know, I just hate when, and it's so funny because now that working in this field and then getting the filler, the Botox, everything, I start to notice, like, when I'm, like, walking or I can be somewhere and I'm like, ooh, she needs, like, to fix the smile line. I'm like, ooh, she needs some Botox right here. It's just like, do you do that?
That's one of my toxic traits. I can't turn it off.
Yeah.
Even I'm watching TV, like news broadcasters, my husband is like, will you stop it? I'm like, ooh. I'm like, oh, Lord. Like, and even if it's too much Botox or too much filler, like, then and it's like, you can see it when they're talking, and it's like, oh gosh, she has to dissolve that.
Yeah.
Like, I do it. Yeah, I can't help it.
Wow. So that's interesting. I know I need some. You're going to tell me what I need?
Yeah, when we done.
No, I know I need a touch up. It's been a while. It's been a long time. Okay, so when it comes to both with body sculpting, non-invasive procedures, as well as the facial aesthetics, right? What type of care, pre-care, or anything that a client may need to do before having the procedures or services with you both? I don't know.
Yours might be more lengthier. You want to go ahead and start?
So for me, I always tell my clients not to eat 2 hours before their service.
Okay.
To stay hydrated. Not to wear any lotions or body products in whatever area we're going to be treating. And most definitely, I always do a consultation because I want to make sure this is what you want to do. This is exactly what you want to do.
Right.
Just because you may see it on social media, you may see the before and after, this may not be the kind of service that you may want or you may need. Sometimes I do have a lot of clients that have like loose skin. So they want to book for skin tightening, which is radio frequency. But we all know that radio frequency, depending on how loose the skin is, the machine is not going to help all the way. So I just kind of always do a consultation just to kind of let them know, hey, this may not be the service that you may need. But I always tell them not to eat 2 hours before the service, drink lots of water, and just prepare.
Wow. Now, do you, do you do the consultations in person?
I do them in person. I do it via phone too.
Via phone too?
Yeah.
Okay.
FaceTime.
Like a Zoom? Oh, okay.
Yeah,
FaceTime.
yeah.
Okay, that's dope. And when it comes to their expectations, right? And you're doing the consultation, they're like, yes, I want radio frequency, but they really need a tummy tuck. What exactly
do I say?
Do you say? Yeah.
I say that.
Really?
Yes, I do. I have to. The thing is, I'm very honest,
Okay.
and any client of mine knows that.
Okay.
Like even when I do wood therapy, I say so. This is a question for you guys. I don't know if you guys ever gotten wood therapy done, but to me, it's uncomfortable. It doesn't hurt. To me, it's uncomfortable.
Yep.
And I tell my clients, to me, it's uncomfortable. Some others say it hurts. Some others don't feel anything. But somebody, as far as loose skin, if it's too loose, I'm going to tell you, I don't want you to waste your money with me because you may need a tummy tuck.
That's awesome.
Yeah,
That's
I would never do that because then you're going to be expecting a certain result that I can't give you.
Right.
So I'd rather be honest with my client completely all the time. And sometimes I may be too honest.
You're too honest?
Maybe too honest. Sometimes I always say, like, I don't want to come off as being, like, too, I'll say raw because that's what I have to be. Like, I have to say these things. And sometimes I say to them, like, if you're not ready to change your diet or to, at least do something for yourself to better yourself, then these are not the services for you.
Right.
Because I don't want you to waste your money.
Yeah, that makes sense. Okay.
Is that mean?
I mean, no, it's not mean. It's not mean. And I like the fact that you are raw with your clients because there are a lot of people out here in Miami, South Florida, right, that will take someone's money and keep it moving, you know? And that's why I feel like it actually makes it hard for service providers like ourselves who are transparent and raw, right? I mean, I wouldn't necessarily say that, but that's just me. I'm like, I kind of move around the...
I'm not rude. I'll say that.
Okay,
I'm definitely not rude. Never
Okay.
rude. But I'll definitely say, okay, if if your skin is too loose, like we can try a few sessions, but I can't promise you these results.
Okay.
So I
yes.
always, because I know the machine is not going to do as such.
Right.
Sometimes clients do need a tummy tuck.
Okay.
And as much as they don't want to do surgery, I'm not going to tell you, hey, I'm going to give you these results. I'm going to make sure your skin is going to be completely, it's going to be tightened right away. That's not going to happen.
Now, do you do services on yourself?
I do.
You do? How often?
I try it once a week.
Okay. Okay.
Yeah, sometimes I'm busy, so I forget or I'm ready
Right.
to go home.
And you're just tired.
Yeah, I'm just tired. But I try once a week. I did it Monday. So
Okay.
I'm a little sore right now.
What areas do you work on?
Just the front.
Okay.
I do the front and like the back of my thighs.
Okay.
And I do wood therapy as much as I can do. Sometimes I get cramps trying to
Yeah,
get back there.
I
but yeah, I do it on myself.
That's dope. I know when I first got into wood therapy, I'm like, oh yes, I'm gonna do it on myself all the time. And by the time I get home, I'm like, yeah, no, it's not gonna happen. We should sculpt each other.
Yes.
And so with that said, do you believe that there's a perfect body?
No.
Oh, so okay, so this is interesting because you sculpt bodies for a living, and you know that there's no such thing as a perfect body. Do you tell your clients that?
You know what's crazy? I never, and I know people gonna think like, no, that's not true. But listen, I really never see nothing wrong with my clients. I really do believe everybody has their own beauty.
Okay.
Like a lot of clients say they have cellulite, and to me, that's a natural thing. If you think about it, yeah, we can reduce it. Yes, we can figure it out and help this cellulite. But I don't see nothing wrong with any of my clients. So I personally don't believe in a perfect body.
Okay. Wow. And so with you bringing up cellulite, I just learned that 80% of women suffer from cellulite. And then they addressed this in the new Barbie movie. It's called Cellulite Barbie. I haven't seen it either. But another surgery coordinator, she was talking to me about this the other day. And I was just like, what? Cellulite Barbie? I'm like, this is crazy.
And you know, cellulite, it comes from if you're sitting down too long, if you're drinking too much coffee, if you're crossing your legs for too long.
Right, weak skin.
Yeah, weak skin. So it really, I feel like it's something natural, and I think it's sexy.
Okay.
I mean, not too much, of course, but
Not too much, of course.
but
Just a little bit.
No, but even though, like, if you feel like you're beautiful just like that, then there's nothing wrong with it.
Okay. All right.
I love that.
Yeah, me too.
I have cellulite. So
so do I. They say 80% of women, I'm trying to tell you. All right. So what about you as far as like different precautions or pre-op instructions for your clients to follow in regards to getting your services?
Okay, it's pretty straightforward and basic, almost all procedures, because it involves me injecting.
Right.
Is to make sure you're not eating anything that thins your blood, staying away from ibuprofen, so that's like your Motrins, naproxen. You can only like take Tylenol, like if you have a headache. Of course, nothing to do with the procedure before. But if you're having any kind of pain before you come in, I would say just Tylenol and stay away from all the other stuff, because then, and aspirin, definitely not aspirin.
It's a blood thinner, right?
Yeah,
Okay.
it's going to thin your blood. I mean, the exception would be like if the doctor has you on aspirin daily. You know, my older patients may be on aspirin daily, then I would say, okay, well, I need a clearance from your doctor. I don't want to just tell you to stop and then, you know, something happens, and then I'll just have to deal with, you know, the side effects if you're bleeding. But it's just, that's pretty much it. And hydrate, like if we're doing IV therapy, ironically, you need to hydrate so I could find your vein.
Right.
Right? If we're doing PRP, I need you to hydrate and have like a low fat, for 24 hours, a low fat diet, because it helps with the plasma. And that's pretty much it. Just come up with an open mind, a listening ear.
Yeah.
And that's it.
Open mind is very important. You mentioned PRP. Tell the people, what exactly is PRP?
So PRP stands for platelet-rich plasma, and that's when I will draw the patient's blood, process it in a centrifuge, and then it separates the red blood cells from the plasma and the platelets. And platelets, you know, it basically is what plugs you up if you're bleeding. If you get a cut, the reason why we stop bleeding is because of platelets. And I mean, it's amazing. Our bodies are amazing.
It is.
Right?
It is.
It's basically our army that like runs to the cut to stops it, right? So that's growth factor. That's our own stem cells. And so if I'm taking that and putting it back on your body, your face, it helps build collagen. It helps really like rejuvenate your face. It's called also the vampire facial. If anybody is ever.
It's so. Let me ask you: have you done that before?
I have done to myself. I do a lot of things to myself. The only thing I can't do is filler.
Okay.
But yeah, so I have done PRP. I've actually drawn my own blood.
Wow.
Yeah.
Now,
and
was
I've done
PRP painful for you?
I really have a high pain tolerance, I feel.
Oh, okay.
So I numbed it, but I've injected myself without numbing myself before.
Really?
Yeah.
Oh, you're
and I feel
crazy.
it, but I'm not like I feel it, but it's like my tolerance is higher.
Right. Oh
So
my god.
I numb myself sometimes, and sometimes I don't. If I don't have the time, I don't numb. Yeah.
Okay, so I like the effects of PRP, but it was another painful. Maybe it's just my face. I can't take it because I feel like
Possibly.
anything when it comes to the body, minus with therapy though, is I feel like I have a high pain tolerance and my recoveries are typically really, really good. But when it came to PRP too, like I was a baby. And then they use vitamin C too. It stung really bad.
Vitamin C does sting, yeah. And so I don't usually put vitamin C when
No?
I do because of that.
Oh, okay.
And it's not necessary. Vitamin C penetrates fine, like without doing the PRP and having your patient uncomfortable.
Yeah.
But with regards to the face and you being sensitive, face is very sensitive, especially around your eyes, around your mouth.
Right.
Very painful. Like I can numb people for lip filler and it just takes the edge off. You're still feeling it.
Yeah.
Unless I do like a dental block and then you won't feel it at all. But the face has so many nerve endings and blood vessels. Like, yeah, but in the scalp, oh yeah.
Man, we do so
it could
much.
be painful. I know. The price of beauty.
The price of beauty and having a perfect body that's typically that you can't achieve is just insane. It really is. All right. So with this said, I mean, a lot of people, they want to achieve a certain look, especially when the media, that's all they showcase, right? Social media, the TV, everything, everywhere. And so with that said, a lot of people look up to these celebrities and influencers in regards to the look that they want. So when it comes to working with, which all three of us have worked with celebrities and influencers, what patterns, what trends have you seen in both of your areas when it comes to these celebs and influencers?
I'll let you go first.
What do you mean? Elaborate
'Cause I
for
know you
me.
have more
Like, there's so
experience.
much, but like,
So like what trends have you seen? Like what have you seen when it comes to working with them? So like for me, I've worked with you know, from rappers to R&B legends to reality TV stars, right? One thing that I've noticed with all of them is that they feel like they have to keep up with the different trends. They have to keep up their look because they can't simply go into Target without looking a certain way because the public is always watching. So they feel like they have to stay up on having lip fillers, doing the jaw, you know, weight loss. They feel like they have to do these different things in order to stay relevant and get the people talking and to maintain a look, right?
I would agree. So yeah, so the celebrities and influencers that I've done, I do feel that they feel that way. And I do have a rule when you step into my chair is to give yourself grace. There's no like bad self-talk.
Okay.
Like I'll let you speak and then like after a while I say, okay, I said, so enough of that because you're beautiful, you know? And so we're not going to like bash ourselves. Like, you know, I do have some patients that pick themselves apart and I'm like, I mean, you have, and I like to point out the beautiful things in them that I see that people will come in here and pay for.
Right.
Like, I'll have patients that they're like, oh, my under eyes, I hate it. I'm ugly. And I'm like, you're not ugly. I mean, like, please don't say that. And I said, look at your jawline. Are you kidding me? I said, people pay $4,000 to have your jawline.
Wow.
You know?
That's how much it costs? $4,000 for a new jaw?
You know, for like, yeah, it depends on what your jawline looks like, you know? So, yeah. And so, I mean, they beat themselves up. And like some of these, I'm telling you, some of these influencers and celebrities in person, I mean, they're stunning.
Yeah.
Stunning. Like, look, they look better than they look on Instagram.
Wow.
I am like, are you kidding me? I'm like, you look like that in real life? Seriously, I've said that.
And I know you just did, well, not just did, but you've worked with a popular rapper, and she is stunning on social media. And so
she's
when
more stunning in person.
Really?
Absolutely.
Wow.
110%.
Okay, so were you nervous working on her? I know you can't say the name, but
in the beginning, I was like, I was like in my office, like, oh my god, are you kidding me? And it kind of was a little last minute, like I didn't know, and so I was like, oh, and then like, I mean, she's completely down to earth. I mean, honestly, just how she is on Instagram, she's funny, like that's how she is in person. She's so kind. I mean, like a roundaway girl, home girl, right?
Wow,
and way beautiful, more beautiful. She's beautiful on Instagram. Don't get me wrong, but I mean, I'm like, dang. Like, you fine.
that is awesome. I love when that happens, when they're really cool, down to earth in person.
Yeah, beautiful amazing. Inside and out. Yeah.
Okay. What about for you? What have you noticed, especially on the body sculpting side, and not necessarily cosmetic surgery side?
So somewhat the same. I have a lot of clients that come in and they shame themselves. They talk bad about themselves, and I say the same thing. Just like I would say earlier, I don't see nothing wrong with my clients. I always tell them, like, you're beautiful. Like, look at yourself. I hype them up. Like, girl, you look good.
I love that y'all both do that.
I really do. Yeah. Even when they look at themselves in the mirror, I'm like, look at that booty. Look at the waist. Like, you have to. And it's not even about that you have to. It's more like, I see these things. You need to see these things for yourself.
Right.
So and just like, influencers. I mean, I've done a couple of influencers as well, and the same thing for me. I'm like, you look like this, or you bad. Like you and your personality is amazing. Like it's the same, honestly. And I love working with them. I really do.
You do?
Yeah, I really do.
See,
it's always a vibe.
It is.
It's always a vibe.
All of them? You never had a bad experience? Oh, just me. Okay.
You had a bad experience?
Yeah. Really? I had a reality TV girl, and she was nice and in person, but the vibe, the energy wasn't there, and in unrealistic expectations. And I tried to be as honest. Like I said, I always dance around sometimes around them, but I try to be as honest as I can. And, I felt like the expectations of what she wanted for her body I wasn't able to meet those.
Right.
And it was just like, okay, she wanted me to do over an hour and a half of lymphatic drainage / post-op treatment. And I'm like, girl, you just had lipo yesterday.
Yeah.
I can't make this session longer. You can barely handle the 30 minutes. 30 minutes, and I gave her 45. And so it's just like, you're going to faint, you're going to pass out, and I don't want that. Then it becomes a liability to me. And so she wasn't really happy with that. And, I just didn't get a good vibe. I didn't like it at all.
Sometimes I do get like, they'll come in and they're very quiet, and they'll have like this face. And for some reason, I don't know what is about me, but I'm talking to them, and I kind of bring that out of them. Like, so what's going on? Like, and I start talking to them, but I do get what you're saying. Though.
Yeah.
I've experienced that, but then at the end of the session, it's always like, we're talking. Now you're smiling. Now we're having conversations. Because as I'm doing their service, I'm like just talking. So what is it that you're eating? How's your diet? Or what expectations you want? Or what is your weight goal? Or what is your body goal? So but I do understand what you're saying.
Yeah.
I experienced that in the beginning.
Yeah.
Same. Yeah.
Same.
You have to kind of like break the ice.
Yeah.
I mean, the ice was definitely broken,
Yeah.
and I would have never knew that there was like something wrong if she didn't tell me afterwards. Because in person, she was like very happy. Oh my God, you made me feel so much better. I was able to sleep better. I don't feel as stiff. Super happy. But then I got a phone call later on in the evening, and it was like, "Can you come back to do another hour?" And I'm like, another hour? You couldn't even like what? And then it was kind of like not a can you? It was like you better come back.
Oh no.
Yeah.
Ouch.
Yeah. It got So no, and I didn't go back, to be honest. I did what I said I was going to do. And, she honored that, the promo that we had discussed, and that was it. We both went our separate ways. And I never even posted her. I never even posted I worked with her, or I never posted her body, nothing, because it left a bad taste in my mouth. Because it's like, if you weren't happy, why did you smile in my face and get all happy-go-lucky and say how good you felt, how nice your body felt after, and how good you looked, if you wanted more? you know? And then her nurse told me that the doctor was like, oh my God, Muñeca did a really great job. Wow. And because she did ab etching. And so the doctor hyped me up. And so then that's when she was like, well, she told the nurse to reach out to me. But I didn't go back. You have one time with me. One time. That's it.
Especially when you know your worth.
When you know, yeah. And I'm glad you didn't, because you never know.
Absolutely. So, well, that's great that neither one of you had a bad experience when working with these celebrities and influencers, because I know it can be tough. And, you know, I feel like I like working with the everyday Joe.
My favorite.
Right, right? And so when it comes to celebrities, I feel like it can be really hard with adding them to your schedule, because most of the time they do hit you up last minute.
Can you come in today? Or can
you come right now?
I have 3 clients. But okay. I'm like, okay, Jesus Christ. But it's really hard to fit into the schedule, and they want them to, sometimes for them it's like, I need it today. If not today, that's it.
Right, exactly. Or the fact that they take up a lot of time.
Yes.
You know, like my session can be 40 minutes and I'm spending like 3-4 hours.
Thank you for saying
Surgery.
that. Is so true.
Yes.
That is so true.
Yeah.
The post-op industry is strenuous.
It's very
no lie.
strenuous.
That's why I had to. I stepped back and scaled it. It is,
Really?
especially if I have a young daughter. Like it, you have to like. It's hard for. If you're married and you have a kid to be a service provider, it is. It just.
And I always used to say that, like, I don't know how I would have kids working in this field.
It's it's tough.
In the space that I'm in, because it's like impossible. Like everything is last minute. The surgeons move last minute. The appointments are last minute.
And you have to be more structured when you have a family. It's just the way it is. It is what it is. Yeah.
And if you're an organized person, like I'm super organized, very structured, it drives me insane. I remember, and with your private care, I don't know if you came across this, but like with the care team, I remember like, okay, hiring different caregivers, and their first question was like, well, what time do I go see the client? And I'm like,
all the time. They're texting you, they're hitting you up, and I'm like, remember, you're on standby.
Right.
That's the nature of the job.
I'm like, the surgery's going to be about 2.5 hours. They'll spend about maybe an hour if they're lucky in post-op.
Right.
I mean, in the recovery room. And then it's like, okay, then you add another 40 minutes for traffic. So I'm like, you got to be on standby. You know, there's no set time. Right. No set time. So I don't know how you, with kids and a husband, do this.
Yeah.
So has it put a strain on your relationship?
Yeah, it did. And that's why. Yeah,
so
it was too much.
Bring it back.
Yeah,
okay.
it just wasn't. It was not possible because, of course, when you have, a family, especially, it's really more so when you have a child, especially that young, and they're not independent, right? Yeah. And you're like the primary caregiver. I mean, you're the mom. I mean, you are the primary caregiver,
right?
And so it gets tough because you have to have structure with them, right? You pick them up from daycare. You have to feed them at a certain time. They go to bed at a certain time. Right. When you interrupt that schedule, then everything is like off kilter, right? And it's like a domino effect.
Absolutely.
And then so it just was like, it was really tough. Yeah. But I must say, it's very lucrative.
A very lucrative business.
It's very lucrative, but it's just like you have to weigh it, right? You have to balance it. Like, I mean, in the parking lot at the surgery center, like at midnight, that's tough.
Yeah.
Like, who is doing that?
At one point, and I talked about this too the other day, at one point, I had to say, you know what? I'm no longer taking clients from a particular surgery center because they used to have patients coming out 9, 10, up to midnight. Even one time I had one come out at 1:30 a.m.
Wow. Ridiculous.
And that means I have to call the caregiver to say, hey, the client's ready. You got to go to work at 2 in the morning, Yeah. And it's like, they didn't sign up for third shift.
Right.
So it's just like, I don't know. I had to put a stop to that.
Yeah. It was, crazy.
Yeah, real crazy.
I salute you guys. I salute you guys. I'm over here like, wow.
Yeah. Well, hopefully you don't go
Shomara
through that. Why?
Yeah, because I'm not doing that anymore.
Oh, yeah. No, those days are
Personally,
over.
yeah.
Those days are over.
I wanted to get into that field, but it's something about me and blood that,
you can't do. See, I could be eating lunch and watching someone getting drained, a tummy tuck procedure going on across the room. I'd be like, ooh, this is interesting. I don't know. I love it. I love it. I love it.
Salute you.
All right. So, I mean, with this said, having the body sculpting on one side and having aesthetics on the other side, private care, I mean, all of these things, right? People have to prepare for these services and these products, right? So a lot of times they have to lose weight to get these services, right? In order to have the goals that they may want, or a certain look that they want to achieve. And so that brings me to the last topic, which is Hollywood's newest secret, really not a secret no more, right? With Ozempic, we have Mounjaro, Wegovy, what else? I mean, I feel
Those
like
are the
there's
three main ones.
those are the three.
Right.
Semaglutide, which is, I know is a form of Ozempic. With that said, like, what has been your experience with any of those? Maybe your clients have shared something.
So I actually prescribe that. That's part of one of my weight loss programs at my studio. And so you did mention that semaglutide is like a form of Ozempic. What it's actually like the active ingredient in Ozempic and Wegovy.
Okay.
And they're Wegovy, Ozempic, and Mounjaro are all brand names. And Ozempic and Wegovy both have semaglutide in it.
Oh, okay.
And so there was a big shortage of Ozempic.
I know.
Because
people were mad.
People were, because, I mean, to back up a little bit, like the aesthetic industry is like we steal everything from like primary care. It's like when you see the side effects of these medicines, it's like, oh, okay, that's how Botox started. Botox was
Really?
never Botox cosmetic. It's botulinum toxin, and people use it for hyperhidrosis, so that's excessive sweating, mainly
right.
for like neurological disorders, so like neurogenic bladder, for migraines, and then side effect is, oh, wait a minute, I look younger. And so FDA lets you use it now for cosmetic reasons. What else? There's other stuff. I mean, like, this is not cosmetic, but Viagra did not start,
in the bedroom?
Exactly, with ED. Like, I mean, men are like happy now and women.
Wait. Where did they get Viagra
It's a
from?
heart drug. It's a cardiac med.
Really? Oh, wait, is that why a lot of men, if they do too much of it, they have heart attacks?
So I don't know if you've ever seen, they have a lot in the movies. Like there's one particular movie, I think, with Jack Nicholson, and he's in the ER. I don't know. And
No,
then
I've
they're
never
like,
seen it.
are you taking anything that will
I think I've seen that.
contraindict?
I think
I
I've
forgot
seen
what
that.
it's
I
called.
forgot
It's
the
a
name,
comedy.
but
It's
I
so
think I've
funny.
seen that.
And he's like, no, I'm not on any ED drugs. I'm not on Viagra. And then he's like, okay, no problem. I'm going to give you a drug. It might stop your heart. He's like, yes, I want it. So yeah,
No
you have
way.
to, and a lot of men don't want to admit to it.
That they're taking it, right.
But yeah, it's a medicine.
Wow.
And that was the side effect. They found out that men were having erections, long-lasting ones.
I like how you said long-lasting ones.
Yes. And it's like, okay. So now FDA approves it. That's how it works. Like, you find it out, and then like there's this demand for it, and now you do the
Insane.
research, and then they FDA approve it now, and they slap the brand name on Viagra.
Wow.
And they change maybe some
that's
active
nice to
ingredient or
know.
whatever,
I
but
love it.
it's basically we still, they steal things from
Wow.
these meds. Yeah.
Interesting. Very
Yeah.
interesting.
So with regards to the weight loss, so now there's compounding agency pharmacies where when I say compound, the pharmacists are actually going in there like chemists and creating this active ingredient semaglutide because of the shortage. And so that's where we get it from. Like most weight loss programs use semaglutide, and now they're compounding the active ingredient in Mounjaro, and they're all like in the same class. They're anti-diabetic drugs.
Okay.
And same thing.
So for someone who is interested in these weight loss injections, what should they do?
Meaning, what do you
Should
mean?
they come to you?
Oh, yeah,
What-
sure, absolutely. I wasn't
Well,
sure
of
if
course
that was
they
like
should
a
come.
plug moment.
Yeah. So
Yeah.
come to you, and then what do you do? Like, what does the consult look like?
Okay, so the consult is very extensive because you have to fill out a lot of paperwork because there are side effects to the med. It is primarily originally an anti-diabetic med for like type 2 diabetes, right?
Okay.
So it's an injectable once weekly, and so you have to go through all of this with the patient, let them know, I may be able to inject, depends on the program, but primarily you're injecting yourself once weekly. You're doing blood work. So I need to know, okay, are you a candidate for this or not? And then most people are. It's very rare.
I was going to say, what makes someone not a candidate? If
So
they're,
there
like,
is
too
like a
skinny?
that.
Really?
Absolutely.
I was just kidding.
So I had a patient, she was like, oh, can I get some Semaglutide? And I'm like, I could kind of eyeball it and look at them, but I said, okay, well, what's your height and weight? And if their BMI is under 27,
yeah.
no. 27, you're quote unquote overweight.
Okay.
You know. You
Wait,
can look
27 BMI?
Yeah, I mean, literally, like you can
so I'm
see some.
considered overweight.
I can kind of eyeball it
At this point, I'm obese.
because I do it. I could eyeball and say you might not be 27, you know.
Okay.
And then obesity is 30 and above.
Okay.
And then so yes, you can. The diagnosis would be obesity if it's 30 above, and then overweight, 27
Okay.
and above.
Wow.
So that is one that you can't get it if, you know, and then the other is if I see something in your blood work and I'm like, no, or you have to have family history of a certain disease, then no. Or if you're taking other anti-diabetic meds,
Oh, okay.
then you'd have to get like a clearance from your primary care doctor.
Wow, this is serious.
Yes, medicine. Yeah. I know a lot of people don't think there's like this misconception because it's making you look a certain way or it's aesthetic.
Right.
You're beautiful that we're in there like playing games, but like you
Right.
can really cause harm.
So I like the fact that you bring this aspect to this because if you look on social media, right, I see so many body sculptors and other people literally get on live and they stand up and they show them injecting the medication and they're and I'm like, so it makes it seem like, oh, it's not
It's
that
normal.
serious. It's normal. It's just
right.
something that you could do on your own, you know? And I'm
Right.
pretty sure you can do it on your own, right? But they make it seem like it's just not that serious.
Right.
You know, and so I like the fact that you're saying like, no, this is serious. It is a drug, you know, and it has side effects. And I
Absolutely.
just saw something on Instagram the other day. I don't know if you guys seen it, but a big blog posted that Ozempic caused a woman hell and she had her stomach was paralyzed.
Yes.
So can you talk to us about that? Like, is that a true side effect that people
That
go through
is
that?
now becoming like I just told you I saw it yesterday, and this class of drugs does cause the reason why you're losing the weight is because it causes slower gastric emptying, right? So you feel fuller longer,
Right, okay.
Right. So if it's doing that, it's acting so heavily on your stomach, you're gonna have some kind of side effects. So I usually tell my patients, so if you have a propensity for like a certain GI characteristic, then it's going to like amplify it. So if you tend to be, not regular, tend to be constipated, you're gonna be more constipated. If you tend to be nauseous, you're gonna be more nauseous. So with the paralyzed stomach, it's basically it's a rare side effect. It's not something that's common.
Okay.
So it can happen because it's
common, but it
acting.
can
No,
happen.
it's not. I mean, now it's just becoming prevalent because, people are probably were having it and not realizing it, but yeah, it's not, it's rare. for that to
Okay,
happen.
so with you giving this as one of your weight loss programs, have you done it?
Yes.
Oh, so
I'm
what
on
has
it right
your
now. What happened?
what has been your success story with it?
Okay, so I'm like probably 25 pounds down.
Oh,
like I
yes,
gained
yes.
and lots of inches. I feel like I wasn't seeing like the needle move on the
Okay.
scale, and I'm like, man, like this is like But I practice what I preach, and like I tell my patients to stick to it.
Okay.
And yeah, it's just like overnight, like it just started like coming
Overnight.
off. Well, not overnight, but like, you know what I mean? Like I looked in the mirror one day, I'm like, okay, all right, I see it.
You start to see it, the
I
results
started to see
more.
it mostly in
Yeah.
my face at first, and then now I'm starting to see like the jawlines getting sharper, because I do gain a lot of weight in my face.
Okay.
So
Yeah.
I tend to see that, quick, and then my waistline
You look
is
amazing.
coming down.
Right.
Hey,
Yeah, you look
Great.
amazing.
Thank
You look
you,
All right, so are you
thank
still on it?
I am.
Okay. How long
I
do you
am.
plan on being on this for?
Not much longer. I
Okay.
think I want to lose probably about like 7 to 10 more pounds.
Get
I
outta
don't know. We'll
here.
see. We'll see. And I'm much heavier than I may appear.
Okay.
I'm heavier, but
I feel like you carry it well. Like I feel
Thank
like
you.
you look very slim.
Thank you. Maybe it's my height, but But I appreciate that.
Yeah, I feel like tall people, y'all can get away with like looking a certain way.
I have a question. So, from how long would it take for a person to lose a certain amount of weight? And I'm asking because I do have certain clients that they may want to get into getting the lipo shots, and I may just send them to you. I don't mind. So, like, how long would it take for a person to lose up to 10 to 15 pounds?
Depends on the person.
Okay.
Because what happens with this med, you're injecting it, and sometimes people don't feel that positive side effect right away. I have some people, we titrate the patient up, right? So you're not taking the same dose you're taking from day one, right? So day one, I have people who they don't eat a thing on the first dosage, right? And then people like me, I was still eating like
regular?
Yeah.
Oh, wow.
So you kind of have to trust the process. Because I can't start like at 50 units. I have to start at 10. Because then I'll have those GI side effects. Like my body would be shocked, like what's happening. Right. So I have to titrate up.
Wow. So you started at 10 units.
Yes.
And then what are you going to get up to?
You can go up to 100.
People take 100
Which is just 1 ml. When people
like
think
one syringe.
Yeah, it's just one ml. And 1 ml is like nothing. 1 ml is like a teaspoon. Less than a teaspoon, probably. Yeah.
Really?
Yeah, because a teaspoon is, I think, 5 ml. Like 1 ml is so, it's such a small amount. And insulin needles are so skinny.
That's true.
So when we're saying units, it's just like a notch. Like, so yeah, 100 units is just 1 ml.
Interesting.
That translates into like 2.5 milligrams.
Is it painful?
The injection?
Yeah.
Depends. That's subjective.
Okay.
Like to me, I just got like there's no problem. Shomara might be like, it just depends. Like some people are like, I have to inject myself. I had one client, she was hyping herself up. I sent her a YouTube video.
She was hyping herself up.
She was like, I can't do this. And then she was like, like after she did it, like,
yeah,
it's literally like an insulin needle.
Some people
it's
just
the
don't like
gauge
needles
is
at all.
Yeah, it's just it's you hardly feel it, and you're injecting it into your fat.
Okay.
So it's like cushion, like you.
So you inject it into your stomach.
Into your stomach. That's the easiest place to inject it. Like if someone's doing it for you, they could do it on the back of your arm. Like you could do it on like the fatty part of your thigh. Okay. But it's harder because you have such a big muscle on your thigh. Right. So it's easier just to squeeze up that belly fat and almost everybody has fat on their belly. It's like unless you wouldn't be on it, right?
Right.
Like,
exactly.
You wouldn't need it. So.
Wow, anything for the body, right?
Anything for the body, anything for the booty.
Wow. Well, thanks for tuning in to Behind the Body MIA Edition podcast. If you like what you heard or saw in today's episode, please like, share, leave a review, and be sure to subscribe to our podcast. If you have any questions about the topics we covered today or past episodes, please leave a comment below. Thank y'all.
Thank you for having me.